Yeah, we're attendees at 0.
Oh boy.
Okay, so hello and welcome to today's webinar hosted by the Lakeville District Library. Hopefully you're all in. This is Kids Mental Health in the Time of COVID. So we have child psychologist Dr. Jeffrey Karst of the Children's Hospital of Wisconsin, and he's going to discuss the effects of kids' mental health from COVID, health anxiety, e-learning, and extended screen time. So you can learn how you can support your students and children during these challenging times. If you have a question for the presenter, we're going to do that at the end, so you can put it in the text box and I'll try to collect all of them. At the top of the chat box, I linked to the slides for the presentation and then also the handout of extra resources. If you are a K-12 Illinois teacher who wishes to receive ISBE CPDUs for this webinar, you have to email me. My name is Rachel Reinwald, and my contact information is also on the Q&A. Send me your full name, the school you work at, the grade level or subject area, your IEIN, and a copy of the 7721, the evaluation form that you fill out after the program. So I linked to that too with our information, and my email is in the chat box. You have a week to send me your evaluation so that I can collect all the information for the state. And then just a little disclaimer for the discussion section. Discussions on whether COVID is fake, whether you should wear a mask or not, whether schools should be open, and any other political discussions will not be tolerated, and you will be kicked off the webinar section. And now that we're done with housekeeping, if you have any questions, you can put that in the Q&A too. I'm going to let Dr. Karst take over.
All right, well, thank you, Rachel, and thank you everybody for joining. I really appreciate the chance to speak with you about kids' mental health in the time of COVID-19. So just to briefly introduce myself, I am a pediatric psychologist at the Children's Hospital of Wisconsin and assistant professor of pediatrics at the Medical College of Wisconsin. So my job is working with children with cancer and blood disorders and their families, and helping them learn to cope with and adjust to their illness and deal with the many side effects and impacts of their treatment. So in this sense, I've actually had some experience over the years in dealing with many of the same issues that families are facing today, from what it's like to be fearful or worried about infection, missing out on school, having to attend school virtually, and just feeling disconnected from friends and from the community because of the need to be distant for that reason. So I speak to you in part as a psychologist who has some experience working with those issues, and I also speak to you as a father of 3 young children, and 2 of whom have just started their virtual school, and knowing how difficult and how stressful this is for families, and for teachers and for parents as we juggle multiple demands, as we try to do the right thing and teach the right way and parent the right way in what is a really unprecedented situation. So I'll speak to you from both of those perspectives and hopefully be able to offer some guidance, and certainly hopefully answer some questions at the end of our discussion today. And I'll start by talking a little bit about mental health in children more broadly, and just sort of detail a little bit about how we really conceptualize or think about mental health in pediatrics, before transitioning to the impact that COVID-19 has had on children across the country and across the world, and how children's mental health has been impacted by this current pandemic. And then we'll transition to talking about what are some primary concerns that teachers and parents and children have, and what are some potential strategies that can be implemented to help address some of those concerns. So starting with talking about mental health, I think you hear a lot about the idea of this mental health crisis in our country. And this was even true pre-COVID. There is a lot of discussion that there is a mental health epidemic and that we have broad concerns about the mental health of children. But what does that really mean, and how do we define that? Well, it's really multifaceted. It refers to how children think, it refers to how they behave, and it refers to their emotional well-being. So it really covers all of those dimensions. And it's also developmental. It is a sort of changing construct over time. When I think about the mental health of a 4-year-old and the mental health of a 10-year-old and the mental health of an adolescent and a young adult, that really differs in terms of what aspects of mental health are most important and most critical at all of those different stages. It's also extremely tied into the culture and social norms and beliefs that accompany a child and their environment. And so in this way, it's really important to understand that mental health is a very contextual thing. It involves not just the child. Mental health is not this aspect that is this individual kind of variable that a individual child has. It's more about the child and their overall environment, the people around them, including their family, including their school and their teachers, including the relationships among all of those different people within their environment. And as you know right now, for a variety of reasons, those environmental stressors are very real and very present. When we define mental health, there was sort of this way of thinking about it in the past where it was looked at as one spectrum. On one end existed mental illness or children who were mentally unwell. And on the other end was mental health, children who were thriving from an emotional or mental health standpoint. But I think that when we think about mental health, especially when we're facing something like COVID, it's helpful to think about mental health as actually existing across two spectrums rather than one. On one spectrum is the challenges that a child may have, whether those are individual or family level or social level challenges. And so COVID is certainly one of those immense challenges that we're all facing. But on the other spectrum is the strengths that a child and his or her family and community may have. And I think what's helpful about defining mental health in this way is we don't view a situation as difficult and complex as COVID as invariably pulling a child down. Rather, we can look at it as a challenge where we need to draw on those strengths and where we need to find aspects of resilience within, again, not just the individual, but also the people around them and the environment that they are living within. So COVID-19 has had a pretty broad and at times devastating impact on the mental health and emotional well-being of children. One of the first concerns that people bring up is this social isolation, that COVID has created a physical and a maybe even more worrisome and emotional separation from children and the peers and the teachers and the community members that they feel connected to. And we'll talk a little bit about what that social isolation is like and how this has impacted children. It's also led to a great deal of anxiety and uncertainty. When I talk to children here in our hospital, it's notable that children are certainly anxious and worried themselves about COVID, about school, how everything is going to go this year, but they also pick up on the anxiety from their parents and from other people around them. I've heard children mention or discuss things that they have overheard their parents talking about, or they have overheard people in their family mention. So it's not only an individual anxiety, but it's sometimes the anxiety that is reverberating throughout the entire family. Children are also really creatures of habit. For most kids, they really thrive on structure, having a set schedule, having consistency and rules and expectations. And COVID has brought about an immense number of changes in routine. There's a lot of uncertainty about what comes next. And so that schedule that a teacher lays out for the week may be completely changed by something happening in the classroom or by a few kids being out sick. And so it's really requiring a great deal of flexibility from children and from their families and from their educational systems. We also know that unfortunately, COVID-19 is associated with a lot of resource loss. And this can be, for many parents, a loss of jobs or loss of financial resources. We certainly know at the educational level that schools are incredibly strained by the loss of resources associated with COVID at a time where more than ever resources are needed in order to meet the variety of needs of children and families. And finally, perhaps most notably, there is just this increased level of demands. And again, this is on every level. Parents and teachers are juggling multiple responsibilities. They're increasingly busy and overwhelmed, not just with their own jobs and their own children, but in trying to navigate these kind of times of uncertainty and discord. And that can be really difficult for everybody, and children pick up on this. And I thought this overall feeling was best exemplified by the 7-year-old child of a friend of mine who noted to her mom, looking kind of wistfully at a playground, "I wish I had got down the slide more before coronavirus." And I thought that this quote really kind of highlighted this sort of pre-COVID existence that many people had and how life seems to have changed post-COVID. And for children, this can impact a lot about not just how they see the present moment and the distress they're feeling right now, but their fear and uncertainty about the future, not knowing if these things that they used to enjoy and these things that used to be meaningful and important to them will be there again in the future. And that can be obviously really unsettling and really difficult to deal with. And I apologize for those following along with the slides that were posted. I switched concern number 1 and 2 around, but I decided last minute that I wanted to highlight and talk first about this anxiety and uncertainty that many people are facing and dealing with right now. And when we talk about anxiety and uncertainty, we can really be referring to 2 different things. And I think it's really important to distinguish these. In many cases, especially within psychology, we talk about anxiety as an abnormal response to a common situation. So my children, for example, are very fearful of dogs. We don't have pets at home, and somehow along the way, they became very fearful of being around dogs. This is a pretty abnormal response. We walk by a lot of dogs in our neighborhood or when we go to the state parks. And so this isn't a common reaction to be fearful of dogs. Children may have separation anxiety or social anxiety that is developmentally not typical for their age. But with COVID, what we're dealing with instead is a common response to an abnormal situation. And I think that this is important conceptually to think about, that the distress that children are showing, and for parents and teachers, the anxiety and distress that you're feeling is really normal. It's the situation. It's dealing with a global pandemic. That is what is problematic. So there can be a tendency to pathologize or think, what is wrong with me? What is wrong with my child? Why are we all struggling so much to deal with this? But it really is the situation, not the individual, that is the problem. And when we have anxiety, when we are struggling with these types of situations, this can come out a lot of ways in children. One of the most common things we see is a lot of reassurance seeking. Kids asking over and over to a parent or to a teacher, am I going to be okay? Are my grandparents going to be okay? We also see a lot of separation anxiety. For many kids, they have been home almost exclusively since the middle of March. And now for those who are going back to school, or for those who are at least starting to venture out of the home more, this can be incredibly difficult. Children also manifest anxiety as physical symptoms. So quite often it is a stomach ache or a headache or feelings of fatigue. And that is how children can express the anxiety and the distress that they are feeling. We also just see a lot of emotional lability, or these kind of rapid mood swings from feeling really excited and really happy about going to school to all of a sudden being really worried and really upset. To go from being really looking forward to seeing one's friends to feeling really shy and reticent to interact with others. I also think that at the very basic level, children have some of the difficulty with anxiety just impacting those kind of basic living things like eating and sleeping. And we know that anxiety can certainly not only create more difficulties with eating appropriately or getting enough sleep at night, but this can reciprocally make anxiety worse. Children who aren't eating enough, who aren't getting enough sleep, tend to have more difficulty with implementing strategies to improve their emotional well-being. And finally, we know that anxiety can manifest as difficulties learning. It's incredible when I talk to parents in our clinical setting, how often children who are feeling really anxious and overwhelmed have completely tuned out and struggled to listen to what's going on in the classroom. Their minds overtaken by distress and worry about things far beyond learning fractions or the book that they're reading in class. So how do we manage these things? Well, I think a couple of key points in talking about managing mood and anxiety concerns, with the caveat that seeking professional help or therapeutic intervention is also really important at times. The first is to acknowledge and accept that this situation is difficult, and to talk at the family level and in the classroom that these feelings that many of us, if not all of us, are having are really common. And we can try to swim against the current. We can try to fight off these feelings. But sometimes that takes more mental energy than just allowing us to accept that this is how we feel right now. This won't be the way we feel forever. But COVID has led to a period where we are understandably distressed, and it's okay to understand and accept that. In that same vein, embracing that there is a lot of unknown can be helpful. Most adults, and certainly children, like to know what to predict, what to expect, what's coming up next. Again, it's that sense of familiarity and routine that helps with anxiety for many children. But I think it can be helpful in this light to talk about embracing that some of this is unknown. We don't know when there's going to be a vaccine. We don't know when schools are all going to be open safely. We don't know a lot of information right now. And rather than worrying about the fact that we don't have every piece of information we'd like, it can be helpful to just say, let's focus on what we do know. And that's related to this next piece of finding control. It can be helpful to sit down and just very concretely discuss what is within our control right now. In working with pediatric cancer patients, I do this a lot. The treatment course for these children can be very disruptive, and a lot can feel like their body and everything in their entire world is really kind of upended. And it can be helpful to find areas that they do have control over. And for a child or for a family to figure out, what am I still able to control in my life? And in that sense, to establish a new routine, to come up with a quote unquote new normal for children, for families in the classroom, to figure out when we have control, when we can set a routine in place, how do we do that? And finally, I think what is really helpful in these situations where we don't have all the control, when we don't have all the facts we would like to have, this concept of mindfulness can be really helpful. And I could give an entire talk on kind of defining and discussing the benefits of mindfulness, in part because I think it's such a wonderful approach. But at the core of it is really allowing ourselves to be in the present moment, to not judge how we're feeling, but rather to sit with those feelings and accept that they are just that they are just an emotion, they are just a reaction to the situation we are dealing with. And allowing ourselves to do that can be really helpful in achieving that acceptance of the fact that right now things are really difficult. And while that's not okay, it doesn't mean that it isn't something we can get through. In the classroom, this presents a particular set of challenges. And I think for a lot of teachers, the questions that I've seen relate to, how do I reassure children? How do I respond to those questions, those worries that children may have? And the first thing that we tell a lot of families within the pediatric cancer world is just be honest. Children really benefit from knowing that they can trust the adults in their lives, whether that's their caregivers, whether that's their teachers or their school personnel, knowing that reassurance is helpful, but honesty is really the most important thing. If something is difficult, if something isn't going well, it can be more helpful for children to know that, so that when you tell them that things are going well or things are getting better, they believe you when you tell them those things. The second thing that can really help in the classroom is developing this association between learning and safety. And I've talked to a lot of children in our clinical setting, especially the young children I work with sickle cell disease who are going back to school and worried about their own safety, that education is really about safety. That children in the classroom who are learning, that's the foundation for what is going to make this situation better, right? Whether it's from a medical standpoint or simply from a kind of social improvement standpoint, the fact that children are in the classroom or on a computer and learning and educating themselves and getting this incredible wealth of knowledge, that is actually what is associated with being under control and having more safety in these situations. And finally, I encourage teachers and classrooms to consider how children can signal distress. One thing we know from looking at studies and research on children is that that sense of safety for children isn't necessarily about being in a safe situation, but knowing that if the situation becomes difficult, there's an escape path. And so that ability to signal distress, to highlight to a teacher or to covertly send a signal to somebody in the classroom that I'm struggling right now, I need help right now, and doing so in a way that doesn't call themselves out can be really helpful. And even if they never use it, in fact, sometimes giving them these strategies helps them to never feel like they need to use these signals. It gives them that reassurance that if needed, they have that tool in their back pocket. Lastly, I'll talk briefly about what we call COVID agoraphobia as it relates to anxiety. So again, a lot of children really struggling to leave the home and get out of their house after having been there for months at a time. And one thing that I think parents can talk about in this light is the sense of fear versus caution. And I think this is really helpful because we've heard a lot and continue to hear a lot about COVID and how this is associated with a fear response. And I think it's so much more helpful to talk about how we're being cautious than the fact that we don't need to be fearful, but rather we can take the appropriate precautions to help ourselves stay safe. And in the same way, I think there is an easy association that can be made for kids that being socially distant and taking appropriate precautions is about avoiding people. And I think if you talk about we're staying away from people and we're trying to avoid being around or close to people, that can create a sense that people are the danger. And sometimes even for young children, highlighting that it's really not people we're trying to stay away from. We're trying to stay away from germs, or we're trying to stay away from a virus, and that there are ways to do this while still connecting with and interacting with people. And finally, gradual exposure can work wonders. So for children who are struggling to leave the home, to get out of their house, just doing this in slow, steady, and incremental ways can be really helpful as children adjust to getting back out there or going to school when they've been at home for so long. The next concern that's often brought up is this fear of the fact that social distancing is equated to social isolation. And when I think about what children are missing socially right now, I think, what do they get from their social connections? What is needed for children when we talk about their social life? And I think it's really three main things. It's feeling connected to their friends, feeling that sense of connection based on their interests or their values or their hobbies. It's also about feeling understood. For a lot of parents who've had especially preteen or teenager say, "You don't understand me," or for teachers whose students could never believe that you might understand what they're going through. Being around peers offers that reassurance that somebody understands what they're going through. And also feeling supported. One aspect of social isolation that can be really hard for children and teenagers is that peers provide that sense of social support. And we know that as children get older, as children grow up, they begin to rely more and more on that peer group for support. So given that this is what is needed, finding ways to get these needs met is still really crucial. And it can take a lot of creativity to find ways to help teens connect with their friends. It can take a lot of empathy to show them that you are trying to understand what they are expressing. But most importantly, it requires and it really necessitates that support. It can be hard to support children when they're struggling this much because you don't have all the answers and you don't necessarily, again, know exactly what to tell them or how to tell them these things. But just telling them that you care and that you are there to support them can mean a lot. Within the classroom, fostering connections among children can be really difficult, whether this is in a socially distanced classroom or in a virtual setting. When I think about fostering these connections, it's really about sharing these experiences. And so I talked about mental health as a process of or variable that includes thoughts, behaviors, and feelings. Well, it's really in sharing all three of those domains that children can build connections. So sharing thoughts and developing a theory of mind can be really helpful for kids. Again, whether that's online or in person. Finding activities or finding ways to highlight that children may internally be having the same thoughts going through their mind can help create a sense of connection. Even shared behaviors allows children to feel connected to others in very meaningful ways. So if they're on the computer and they're all participating in an activity virtually, doing the same scavenger hunt, doing the same exercise routine, doing something that is the same even though they're in a different place can be really helpful. And again, perhaps most importantly, it's sharing those feelings, that sense that others might be feeling the way that they are. And so finding a way to express their feelings, and as a teacher or as a school staff member, finding a way to facilitate normalcy, that the feelings that they're having are normal and that they are shared among students within the classroom can be really helpful. When this relates to online connections, it gets even harder. And I have had several parents talk to me about this, that their child just really struggles to connect to their classmates or their peers over Zoom. And I think this makes a lot of sense. It really highlights how much we rely on nonverbal aspects of social interaction when you try to connect with others through social media or through a video platform. So one helpful thing is just normalizing for kids. Yes, it is really difficult to do this. It is hard to connect to your friends over Zoom. And it can be really tough to feel like that's a normal conversation or interaction. In fact, one way I've talked to older kids about it is it's sort of like learning a foreign language. You may have the same words that you're using, but all of those other aspects of communicating are completely different. In that sense, it can be helpful for parents and teachers to provide as much structure to online interactions as possible. When left more open-ended, it can create more uncertainty, which often leads to more anxiety, which leads to sometimes greater resistance, engaging and interacting socially. And finally, just understanding limits. We know that these connections are hard, and especially early in the school year and as children navigate trying to interact with others virtually, knowing that this is going to take time. Again, like learning a foreign language, one wouldn't expect to become fluent in a matter of months. And yet, in the middle of March, we sort of expected all of our kids to just take up online interactions. And while children may have been used to connecting virtually through social media or video games, the ways that we're asking them to do so now are really different. And that takes time to learn, it takes time to master, and it can really just take time to feel comfortable with. Another concern that a lot of people have brought up, and certainly I think continues to be an area of difficulty, is how to manage all of the information about COVID. This is another area where my line of work interacts a lot, because when we get a child with a new cancer diagnosis, one of the first questions parents often ask is, how do we tell them? How do we keep them from going on to Google? How do we tell their friends? What words do we use? And these are many similar questions parents have about COVID. And one specific challenge for teachers especially, but even for parents, is that there are a lot of beliefs about COVID out there. And there are a lot of different opinions. And there are a lot of different kind of backgrounds and ways of thinking about the pandemic. As a parent or a teacher, I think it's easy to get bogged down in the what. What is true and what is not? What is an opinion and what is fact? And so I think it can be helpful to emphasize the who. Who should we be listening to? Who are the trusted adults in your life? And who are the people that you can listen to and get information from, especially for children if you have questions? Acknowledging that at times things are going to be different. And there are going to be rules at home that differ from those at school. And there may be different rules at the grocery store than at home. And that's okay. Again, Though children thrive on consistency and having a sense of structure and sameness, it is okay to learn that in certain environments, the rules may be different. But, and I think this is the important caveat, finding common ground is essential. For children, it's helpful to know that there are underlying beliefs or underlying values that we're all seeking, right? I think for the most part, can all come to agreement on some of these core important commonalities, like the desire to help keep kids safe, to help them be educated and receive a strong education. And I think finding common ground in those areas can be really helpful and be really reassuring. How do you know, though, what to say to kids and how to answer their questions? Well, the first advice I give in this respect is to use their questions as a guide. One helpful thing for both parents and teachers is just to ask children, what questions do you have about COVID? And it is not only helpful because you can then hopefully answer those specific questions, but using their questions gives you an idea of their level of understanding, what information they have, and what questions they truly have about what's going on and what they need to do. And then developmentally, to just use consistent terminology. I think one of the difficult things is we end up with a lot of ways of referring to COVID or coronavirus or COVID-19 or SARS-CoV-2, and you hear a pandemic, an epidemic, and there's a lot of different words that get used. And especially for younger children, that can be confusing. So the more consistent you can use verbiage and terminology to refer to both the disease and the safety precautions you're taking, that can be really helpful. And again, given that mental health is a developmental process and really changes over time, initially talking to kids about COVID and talking about the things that you're doing in your home or in your classroom need to be really concrete for young children. Sometimes we run the risk of offering a lot of information and sharing a lot of details with kids, assuming that the more they know, the better. But sometimes that can cloud things. And the more concrete, straightforward, and basic information you give, the more likely they are to truly take home the important messages that you're trying to get across. And as they get older, as we enter the teenage years, we know that children are better at abstract thinking. And you can use more examples and analogies and talk in more detail about some of the questions that they have. Another concern that is really common, and I've talked to a lot of parents and a lot of friends, and I constantly am talking to myself about this one, is the idea of being perfect during the pandemic. And I like to refer to this as the illusion of perfection. And the picture here is what my son showed up as one day while I was in the middle of a Zoom meeting and realizing just how hard it is to do everything that we're being asked of all at once. So again, I think that part of this is really kind of embracing the chaos and knowing that right now there is so much anxiety and uncertainty. There's so many changes. There's so much that we don't know. It's impossible to do anything perfectly. And instead, for children, it's about setting goals and setting limits. And I think this framework can be really helpful, whether it's as a parent or as a teacher, that you really try to define what you want to achieve, whether that's at home or in the classroom. And then what are the things that aren't okay? What are the limits that you need to set? How much is too much for treats or screen time or anything else? And then balance those two things out. You can work toward your goals while trying to set those limits, otherwise understanding that there's going to be a lot of difficulties in keeping this balance in between. And most importantly, that you need to engage in self-care and you need to seek support. Again, it's hard to be perfect during any of this, if not impossible. So it can be helpful as a parent or a teacher to reach out and connect with others and talk through these feelings about what it's like to be pulled in so many different directions and trying to manage so many different challenges at the same time. In fact, one specific example of this that gets brought up a lot is screen time. And screen time is an issue for a lot of reasons. One is that children are increasingly on screens as part of their academic and school-based learning. We also know that as parents are trying to work from home or trying to keep kids busy while doing other things around the home, it's increasingly common that children are being babysat for a period of time by a tablet or TV or computer screen. And I think in this light, it's important to talk about quantity versus quality. There are recommendations put out by the American Academy of Pediatrics about how much screen time is too much, how much is appropriate at different age levels. And that's good as a basic guideline, but it really is an incomplete picture. It matters a lot more the quality of content that a child is accessing, whether it's on the TV or tablet or computer. And we know that when children are exposed to screen time, that things that are interactive, whether it's puzzles or TV shows that include interaction, or if somebody is sitting next to the child interacting with them while they're watching a show or playing a game, we know that that is exponentially better for them over more kind of passive forms of screen time. But most importantly, it's about context. Again, we're in the middle of a pandemic. And I think this context is really important when we think about screen time. And when parents express to me, I'm so worried. I'm really upset with myself. My child watched 4 movies yesterday because I had to get this done. And I think this is where the context really comes into play. And I've used the analogy with some parents that it's sort of like fruit juice. We know that an excessive amount of fruit juice has a lot of sugar and that isn't necessarily good for kids. But if a kid is dehydrated, if their fluids are low, we know that fruit juice can actually be life-saving. So I think it's important to think about screen time in this context. Is 10 hours of screen time a day great for kids? In a vacuum, probably no. But in the middle of a pandemic, if you need to get things done, or if that's how they're accessing their learning, or if that's the best way to keep them occupied while you work with their sibling, or you work with other children in the classroom on something else, that's okay. Kids are going to be okay. Other barriers to success, or things that people have expressed concern about. One is wearing a mask. And obviously, this can be really hard for children. The basic advice I can give for masks is to introduce them slowly, help kids acclimate to masks over time. Try to make it as fun as possible, if it's at all possible, to decorate or choose or have some sort of say or fun way to think about masks differently. That can be really helpful. And most importantly, to include choices. Anytime we're asking kids to do things that they may not want to do, the more choices you can give them, the better. From a connecting with students virtually standpoint, again, I think it's really about highlighting those shared experiences. What are things that, although you're in different rooms, although you're connecting over a different medium than usual, what are those things that you maybe have in common? And that can create an increased sense of connection and bonding with students. It's also helpful to use multiple modalities. When you're not in the classroom with a student, I think children sometimes have a more difficult time in showcasing what it is that truly kind of excites them and sort of the way that they learn best, or the things that really are their triggers that make them tick, that help them connect with somebody. So just using different modes of interaction and communication can be really helpful. And if at all possible, setting up some one-on-one time. I think this is something that is so challenging because teachers have so many different demands being placed on them with in-person and virtual instruction right now. But we also know that children who are given some chance for one-on-one individual interaction with their teachers report that that is really helpful in building that connection. A lot of concern is out there as well about virtual learning overall. And I think it's really important to maintain realistic expectations in this sense. Again, we can't be perfect in terms of teaching everything when it's in such a different format. But helping children to manage these transitions, to work from one topic to another, or to go from synchronous to asynchronous learning and back is really important. As well as understanding and normalizing mental fatigue. I know myself, having been on Zoom meetings for hours a day sometimes, participating in virtual learning or virtual discussions can be really exhausting, and normalizing and helping children come up with strategies to deal with this mental fatigue can be really important. And finally, one thing I try to highlight for kids is it can be harder to point out if you're struggling when you're online. So teaching children self-advocacy skills as a parent or as a teacher, and helping them express if they are struggling with something, if there's something that they don't understand, because in a virtual environment, that may be harder for teachers to pick up on. And I think that can really be helpful as well. And finally, from a behavior management standpoint, just utilizing those same basic strategies that are helpful in any situation. Giving ample positive reinforcement and praise when people are doing things well. Using checklists or guidelines to help children follow along. Making sure that the rules and the expectations, whether that's in a classroom or virtually, are very concrete and clear. And doing lots of practice and lots of rehearsal and making sure that those things are very cleanly laid out for kids to follow. And lastly, the overarching or underlying concern that so many parents and so many teachers have are the long-term outcomes from this pandemic on children. And I will say that the phrase we often use in pediatric cancer is that children are very resilient. But I go back to what I talk about with mental health in general when we talk about this construct of resilience, that this is not really about a child themselves being resilient, but about the context that the child is in. And this, what is called this ecological model of child development, really speaks to this. That resilience isn't just about kids, it's about the environments around them. And fostering and building up resilience in children is just as important. So we do this by being there, whether a parent or as a teacher, by letting children know that we are there for them, that we understand what they're going through, and we know this is really hard. And this can be especially frustrating and difficult for parents and teachers when you're being pulled in a million directions. And in this sense, it's important to remember that the perception of support is actually more important than the support itself. So what matters is not that you are omnipresent and you are always physically there. What matters is that the child knows that you are there to support them and love them and care for them and teach them and share in this difficult experience with them. That's what being there means, not being at the child's side every minute and every hour. Continue talking about this. Talking with children about COVID is not a one-time discussion. It's an ongoing process, and normalizing how they feel and how they're reacting is an incredibly important part of helping them feel okay during this unprecedented situation. Modeling coping behaviors, showing children how you are dealing with the stress and the anxiety that come along with COVID is really important. And finally, if you get nothing else from this presentation, as a teacher, as a parent, as a member of the community, struggling with the COVID pandemic in the midst of so many other challenges that we're facing, to show yourself compassion, to understand that it is not possible to be perfect in this time, and that it is really important to engage in self-care, to use the analogy of securing your own oxygen mask before helping others, that it is by taking care of yourself and by showing yourself compassion that you can best be there for your students and for your children through this difficult time. With that, thank you for your attention and would be happy to answer any questions that people might have.
Yeah, so if you'd like to type into the chat box if you have questions, we can go through them. While we're waiting, I know earlier, before when I was polling teachers in general, they were wondering how to connect with their students on like the first, at the beginning of the year, because it's like they're not seeing the whole classroom and it's all online, and a lot of them have like younger kids, like second graders and stuff like that. Mm-hmm. What would you suggest?
So I think this is the real challenge when you're sort of, again, trying to connect with people in this virtual environment. And remembering that kids are often very visual learners and that taking pictures or showing kind of different aspects of the classroom can be really helpful. And just including children and helping them feel like they're sort of a part of that process and that they can even little things within the classroom, offering them some choice about maybe where their picture is set up or where certain parts of the classroom go, can actually help them feel like they are in some ways making an impact or they are present physically there.
And before you talked about modeling coping behaviors at home for children,
Mhm.
not everyone knows what the examples of coping behaviors are. So can you give us a couple?
Absolutely. So one that I think is really helpful, especially for kids, is just doing some basic deep breathing exercises. And I like this one because it's really basic, but it is truly incredibly beneficial for everybody. So just taking a few minutes to do some slow, deep breaths in through your nose, out through your mouth, closing your eyes, and just doing some deep breathing to feel comfortable and feel okay with how things are going. Um, Again, I think that kind of grounding type of experience can be really helpful. Also, expressing emotions. I think a lot of parents worry as a coping strategy that if they talk about how they are feeling, that that's going to cause their children distress. If they say, I'm feeling overwhelmed today, I'm feeling really sad today, or I'm really just frustrated with how things are going, they worry that those expressions will actually upset their children. But I think the opposite is true. I think when parents express their emotions, when they cope by talking about how they're feeling, it actually is modeling for children what that looks like. And it's normalizing that those feelings are okay. So the combination of using some of those physical techniques like stretching or deep breathing, but also in just using these basic kind of guides of how to talk through your emotions can be really helpful. It looks like there's a question about recommendations about teaching mindfulness. There's actually some great resources out there for mindfulness. And I will try to pull up really quickly one that we have used in particular, but I, um, I think the great thing with mindfulness is that it can really be you can really use a variety of different approaches for it. So I can send something out when I'll include that on the resources if we want to do that. But um, one of my favorite kind of mindfulness exercises even is just to sit in a room and close your eyes for 10 minutes and try to observe all of the sounds that you hear over a 10-minute period. And this is a really helpful mindfulness exercise because it really forces you to try to tune out all of those other thoughts that rush into our brain when we're sitting still. And so I think this exercise, again, can be beneficial because children often are able to use that as a way of kind of learning the basics of what mindfulness meditation can feel like. All right. There's another question. Is there any research in process that is looking at COVID and the isolation impact on kids? There is, and so we don't have a lot of answers yet because that research is in process. But looking at how this has impacted their mental health and how this is impacting their learning is certainly an area of interest for a lot of researchers. I wish I could tell you more about preliminary results from that. I think it's, again, kind of highlights though the fact that we're just making educated guesses at this point. We're still trying to figure out how this is impacting people more broadly. We know anecdotally it's really stressful. We know this has been a lot for people to cope with. Um,
Thank you. I'll throw in another question. So I know you talked about kind of like gradual exposure for kids that had health anxiety or anxiety about going outside and like meeting people and stuff
mhm,
like that because they're being told that they can't go outside because it's not safe. So what are some
sure.
examples of gradual activities you could do with them?
I think this is really a lot about a family's comfort level and where things are at for each individual person and child. But I think going to a place where you can be around others without necessarily having a lot of close interactions can be helpful. So I've recommended to families that, going on a walk around a playground can be helpful, or going on a hike somewhere outside where they're around other people but able to kind of keep social distance appropriately can be helpful. Um, or another one that, again, while we get a little bit of nice weather, hopefully still this fall, is doing a picnic outside or something like that with as a family. Just little things that can be done to kind of have a sense of, again, we're around people. We're not worried about people being present. We're making sure we're being safe and avoiding germs. So any of those activities where people are kind of physically present, but where there isn't a lot of direct interaction. And then depending on the child and the situation, building up to some brief, safe, socially distant interactions, and helping children actually be a part of that can be really helpful.
Any other questions? See if anyone throws anything in there.
Yeah,
Any thoughts about homeschooling? What specifically about homeschooling? I don't know if you could add that in your chat box.
And I will, while you're doing that, I did find this this website for mindfulness. So I will post this. Mindfulness.org has a lot of great resources and a lot of kind of helpful guided exercises and activities for children specifically, which is really helpful. In the meantime, before I get to homeschooling, if you have any more specific questions about that, how would you handle the child who is anxious about seeing other kids not follow all the rules upon returning to school? I think this is where that, again, that diversity of health beliefs and different behaviors is really difficult. I understand that anxiety. I think for many of us, we see people who are have different ways of approaching this pandemic. Again, there's no right or wrong way to do all of this, where there's so much that is still unknown. But I think that it's helpful to just talk about, we as a family, or for teachers, even we as a classroom, are all individuals, and we're all kind of making our own best decisions about how we stay safe. So it is stressful, or it is difficult if your friends aren't making those same choices as you are. It can be hard to understand why, but you following what we have, what we as parents or what I as a teacher have chosen as our rules and our plan, that's the best thing to keep you safe. And that's all that is within our control. We can't control how others are choosing to act or how others are choosing to go about safety precautions. Unfortunately, there may be a time where that means I have to decide how much interaction I can have directly with that person. And again, I think that's a conversation as a parent that is about not avoiding that person altogether, but it may be that if you are playing with that person, you may need to choose more socially distant activities. And that's unfortunately kind of the realistic conversations we do have to have.
I don't think the person who talked about homeschooling made it more specific.
So she did add a recommended organization or resource. I don't have, off the top of my head, a specific recommendation for homeschooling resources. I think this is maybe one of the challenges is I know last spring when every child essentially transitioned to home, we got emails about 30 different apps and websites and places to go, and it was almost like an onslaught of information. And it also kind of leads to this difference in definition between homeschooling as a parent-guided curriculum, an e-curriculum, or an e-learning, center, or doing virtual schooling through a school district. But I do think that regardless, it can be helpful to work with a library or a school district to talk about learning resources, and really to find things that work for your child, because it is hard in the sense that not every child learns through the same modalities. So finding sites or finding guides that fit for the way that your child learns is really probably the most important thing.
Yeah, I'm looking up the date now. We do have a separate homeschooling program coming up, and it's this lady that runs homeschooling for like most of Lake County. That's going to be on September 17th from 7 to 9. So if you want to sign up at lvdl.org you can. We also have every other Thursday starting this week, we have an e-learning support group. So if you're a parent looking for more resources or just help in general with e-learning with your students, you can hop on in those, and those will more specifically answer your questions. It doesn't look like we have any more questions today. So I just want to thank you for a really great session.
Excellent. Well, thank you very much again for hosting me. I did include my email address there, so if people have questions that come up afterwards, you're more than welcome to reach out, and appreciate your time.
Yeah, if you guys miss any of that, or if you need like slides or handouts and you couldn't find them in the chat notes, feel free to email and we will email you whatever you were looking for back. All right, thank you.
All right, thank you.